patients are concerned about receiving radiotherapy, I simply explain to them that this modality is different than standard radiation with a linear particle accelerator. This radiation is actually weaker than what their dentist uses to check their teeth with x-rays. So I explained to them that the radiation does not penetrate very deep into their skin at all. It goes about 1 centimeter as far as the energy. For the majority of it, I just explained that all the treatment stays very superficial and close to the skin. It does not pass through the body like standard radiation. I do explain that they will get a dermatitis, but that is to be expected with any form of radiation. But I explain that it is much safer because there's no damage or risk to any deeper organs or tissues.
Well, the fear is understandable because most patients don't understand the depth that we're going to with this particular modality of radiation. Most patients are going to liken it to having radiation for breast cancer or prostate cancer. And we have sort of a team approach in terms of when we contact patients initially after they have the biopsy done to let them know this is superficial, this is not deep. And after we reassure them of that, patients feel much more comfortable. So at this point, we have it down to a science, but I certainly see that little sparkle in their eyes every time we mention the potential for radiation. But once we reassure them, and the tech that we have is fantastic at also reassuring the patient of the superficial nature of this treatment.
I mean, how do you explain IG-SRT to a patient so that they're not afraid of radiation? And we do hear that occasionally. Surprisingly, not as often as I thought I would. I think inherent in the name, superficial radiation therapy, we just use that as a lead-in to say superficial means that it's very targeted, and it's guided by the imaging, the high-tech imaging with ultrasound, and limited to that malignant tumor. There's very little tissue scattered. The normal tissue is surrounded. Your body's not exposed, but your whole body is shielded. This is very different than deep radiation therapy.